Let me continue the diplomatic or protocol necessities. And I forgot to mention a few names. Mr. C.K. Mishra, he is the Secretary for Government of India for the Health and Family Welfare. And also let me acknowledge Dr. Suryapati. He is the chair of BKKBN and Population Commission of Indonesia, and also USAID Mission Director, Dr. Janina, and our Vice Chancellor, Dr. Nabi, the Bangabandhu University, and also our DG Family Planning. And I think probably I'll catch up over the course of time. And let me invite Dr. Karin Hulshof. She is the Regional Director of UNICEF based in Regional Office of South Asia. And I have a particular delight to invite Karin because UNICEF is a new partner with PPD for our journey towards promoting South-South partnership. Karin.
Good morning. Salam alaikum. Partners in Population and Development, Dr. Joe Thomas, of course, our wonderful host, His Excellency, Mr. Mohammed Nassim, Honorable Minister, Ministry of Health and Family Welfare, Government of the People's Republic of Bangladesh, and member of the PPD Board, His Excellency, Mr. Saeed Maleki, Honorable State Minister, and Her Excellency, Dr. Shireen Shamin Chowdhury, Honorable Speaker of the National Parliament, Government of Bangladesh, ministers, ministry delegates, parliamentarians, ambassadors, and of course also my UN colleagues. It is an honor to be here with you all in Dhaka. Thank you to the Government of Bangladesh and to Partners in Development, Population and Development for hosting this very important meeting. Timely too, as your countries have all recently adopted Agenda 2030 and the Sustainable Development Goals. And the UN Secretary General has launched the Global Strategy for Women's, Children's and Adolescent Health, which charts a path towards ending preventable maternal, newborn and child death, enabling every woman, child and adolescent to thrive and reach their full potential. At UNICEF, we are increasingly focusing on adolescents, their health and their overall needs. In 2014, the World Health Organization, UNICEF and UNFPA launched the South Asia Kathmandu Declaration. In it, we said, encouraging family planning and investing more in early childhood development and adolescent health, especially for girls, is critical to ensure long-term public health and economic gains for society. The second Global Health Strategy has that focus on adolescents, and at UNICEF we are thrilled to be part of it. Achieving the SDGs and realizing the vision will not be so easy, but we have seen in all of your countries what is possible during the period of the Millennium Development Goals. We have seen, for example, unprecedented progress in reducing child mortality, which has more than halved since 1990. Bangladesh, of course, is one of a number of diverse countries that can proudly claim to have achieved MDG 4 target of under 5 mortality. We will now need to redouble our efforts to achieve the even more ambitious goals of the SDGs to end preventable death, in particular given globally we did not achieve the MDG 4, and that in many countries we saw increases in disparities, even in the context of mortality reduction. The world is a very different place compared to when the MDGs were adopted in 2001. You and your countries have reflected on this in developing the SDGs, which show a much more comprehensive view of development than the MDGs. Similarly, the global strategy goes beyond mortality reduction to consider the conditions required to thrive. It also brings a focus to the needs of adolescents, long a neglected population group, and who are key to achievement of the SDGs. The global strategy also recognizes that health requires inputs from a number of sectors, not just healthcare, and urges prioritization of the needs of the worst off to place equity at the heart of all our efforts. Now more than ever, it is the efforts of countries themselves that are crucial towards the achievement of targets and progress in the development. So I look forward to today's discussion, and particularly to hear your perspective of countries on how to take this forward, that every woman, every child agenda becomes a reality in all our countries. I will have the opportunity to speak more on our contribution to South-South cooperation, to which PPD plays such a constructive role. In conclusion, UNICEF stands united with all of you in efforts to enable every woman, every child, every adolescent to survive and thrive, in close partnership with national governments, civil society, professional associations, the private sector, and other development partners. We work together to build resilient systems, promote partnerships, foster innovation, generate and share evidence, and engage communities to drive accountability. We commit to implementing the global strategy for women's, children's, and adolescents' health in every setting, prioritizing the most disadvantaged through a multi-sectoral response as proud members with you of the global movement to achieve Sustainable Development Goals by 2030. Thank you.
Thank you, Karin. That is an inspiring words. And also we look forward to the future partnership in promoting South-South collaboration, as well as promoting the goals of every woman, every child, and every adolescent.